My name is Crystal. I live in Liverpool, New York. I'm 37 years old. I was 36 when I was diagnosed with breast cancer. I guess my advice for anyone looking for a doctor or anyone who's looking for a breast care specialist in Central New York, definitely seek out Dr. Keeney and Dr. Greco. Amazing patient advocates, honest, knowledgeable, absolutely incredible. I'm so grateful that I live here. A lot of people think you have to go to these big centers like Sloan Memorial Kettering or Dana-Farber. We have excellent breast care right here in upstate New York.
My name is Julia. I'm from Auburn, New York. I was diagnosed with breast cancer on Halloween of 2016. I found this breast center through some research I did online, and I found Dr. Greco, who is an amazing surgeon. I was so impressed with just all the information they gave me. I was just thrown into this weird world of breast cancer. You never think it's going to happen to you, but it happened to me. So I didn't know really what direction to turn, and the girls in the office and the doctor gave me a lot of information that I just didn't know about. And they always made me feel very comfortable. I always had a list of questions whenever I came in for an appointment. Dr. Greco patiently answered every single one of them. I never felt rushed. I always had a lot more information when I left than when I came. So I knew what I had to do for my treatment. And they were just incredible. I mean, I can't say enough good things about them. I mean, it put me at ease. And I guess what I would say, if I have advice for anyone going through this, is to really do your research and be comfortable with the team that you choose.
My name is Kristen Antonacci, and I'm from Manlius, New York. I came to Dr. Keeney's office very unexpectedly. I woke up 3 nights in a row with chest pain, went for a mammogram the next day, expecting it to be hormones or an infection, something that I had looked up online that I completely didn't even think of breast cancer or that it was even a possibility. So as I was sitting having a mammogram and asked to go back in for more testing and sonograms and realizing that there was probably more to it, I texted a friend who works for Dr. Keeney and explained my situation, and I was immediately brought into the office the next morning. Their office solely is a breast disease office and works solely with breast disease patients. I knew that the focus and the technology and the education and the experience was solely with what was wrong with me, and I was very confident that I had the right doctors and the right practice.
Hi, my name is Laura. I'm a patient of Dr. Christine Keeney, and the reason I'm a patient at the Breast Care Center is that I am the only person in my family who has not had cancer. My beloved sister died from breast cancer, and my brother has survived breast cancer. My primary care physician and I determined that because of the risk in the family, that I should be under the care of a breast care specialist, which is what brought me to Dr. Christine Keeney, and I could not be happier. Dr. Christine Keeney watches me like a hawk. And at one time when I asked her exactly why am I here with you and why do I need 3 studies every year, she said, because you make us more nervous than our patients who already have the breast cancer diagnosis. That's when I knew I was in the best possible hands getting great care.
Hi, I'm Barbara Herndon. I'm from Syracuse, New York. Dr. Keeney was great. All the time that I was going through this pretty devastating, dire result, she constantly was supportful, patient, so smart, willing to spend as much time as I needed talking, even though she had a room full of patients. She's encouraged my ideas about forming a support group for women with breast cancer, because that's so important. We can talk to our families about it, our friends, but we can't really talk to anyone but, someone that's been through it. So I guess my message is self-advocacy for women.